There are cases of neuralgia paresthetica so severe that it is necessary to cut the patient's nerve. I'm going to explain a bit more about this in this video. One of the best things about neuralgia paresthetica is that it improves in most patients even if you don't have surgery. A small percentage of patients end up not improving and then need to undergo surgical decompression. And an even smaller portion still ends up continuing to have pain after decompression, and we need to cut their nerve so they can get relief. In other words, if your pain has only lasted a few months, the chance that you'll need to cut this nerve is very small. The first steps are physical therapy, avoiding tight clothing, and losing weight. Then, if you don't improve after 6 months, that's when we perform decompression. This is a straightforward procedure, performed under general anesthesia, and you can be discharged from the hospital on the same day. However, after decompression, if a few months go by and you still have very intense pain that doesn't improve, then we do cut this nerve. The lateral femoral cutaneous nerve is responsible only for sensation in the thigh. It doesn't control movement, so the patient can rest assured because they won't lose strength in their thigh. But doctor, what if I don't like losing sensation after you cut the nerve? That's true, and it can happen. Some patients find that the numbness is worse than the pain they had before. Therefore, I don't go straight to nerve neurectomy. First, we do a test. That is, at the time of nerve decompression, I inject a local anesthetic and the patient will understand what it feels like when the nerve is not functioning. This way, if the pain remains after surgery, the patient already knows what it's like to have numbness in that area of the thigh. Then, a few months after the surgery, the patient can choose to have a neurectomy if they don't improve from their symptoms. But don't worry, most cases improve with decompression. Tell me, what treatments have you already tried for your neuralgia paresthetica? You may have noticed that there aren't many videos available on the internet about this topic. If you want more content like this video and follow our channel.